Welcome to Shaping Healthcare, a podcast by CitiusTech. Some of the great minds in the world are constantly striving to solve the healthcare industry's greatest challenges with technology, creativity, and agility. With every episode of the Shaping Healthcare podcast, we will take you deeper into the world of healthcare and life sciences and give you a perspective into what it takes to build a human-first, technologically enabled healthcare world. I'm your host, Laurel Rockall.
Today, I am thrilled to be joined by Allison Lee and Brian Dwyer. Allison is a seasoned leader in government programs management and healthcare technology. With over a decade of experience, Allison brings a wealth of knowledge in navigating the complexities of the healthcare landscape, particularly in Medicare Advantage and Medicaid integration. Currently serving as the Senior Director of Government Programs Practice at FluidEdge Consulting, a CitiusTech company, Allison is dedicated to driving innovation and operational excellence in healthcare delivery. Her expertise in aligning business strategy with customer needs and leveraging technology to optimize care outcomes makes her a valuable asset in shaping the future of healthcare. Brian is a distinguished healthcare sales executive renowned for his strategic vision and market acumen. With a career spanning over 2 decades, Brian has held key leadership roles in companies such as Uno Health, Gorman, Curate Health, and McKesson Health Solutions. His deep understanding of population health, analytics, and social determinants of health has positioned him as a thought leader in the industry. Brian's commitment to driving business growth and fostering meaningful partnerships underscores his dedication to advancing healthcare through innovative solutions. Brian, Allison, we are delighted to have you both with us on the podcast today.
Thanks so much for having us, Laurel. Really appreciate it.
Yes, thank you for having me.
Really excited to have this great conversation with you with both of your unique backgrounds and your experience in healthcare and healthcare technology. And I think we're going to learn a lot about what's going on in healthcare tech and finding some solutions and talking about, just maybe these opportunities that are in this portion of healthcare. So, and Allison, I was really curious about learning a little bit more about your various roles within the healthcare industry. I mean, you've had roles from marketing events coordinator to the senior director of government programs. I feel like that really showcases a diverse and dynamic career path. Can you share with us a pivotal moment or an experience that shaped your passion for healthcare tech and government programs management?
Yeah, of course. Thank you for the question. So I'm truly grateful. I've had many opportunities in the government space. It's allowed me to see the health plan from many different perspectives. And really from there, I was able to discover my passion for working with the senior population, specifically with their interactions with the health plan. So when I was initially offered a role at a local health plan, I was in Kansas City. I was to implement a new Medicare Advantage line of business, really seeing it from the ground up, brick by brick being built. And our true main goal was that seamless member experience, a positive experience for the Medicare Advantage members. So from there, I was able to see the foundation of compliance, technology, rollout into a successful thriving health plan now. I was able to gain deeper understanding around those impacts of technology and systems on the business as a whole. And just my initial motivation and driver for the senior population and serving them, it allowed me to see how this influence the members' healthcare journey. So thank you for the question.
Well, that's really interesting because I feel like having an experience like that earlier in your career, that really sets you up for where you're at now. And I think that makes for a really unique advantage in your situation now in the role that you have. So thank you. And for you, Brian, you have extensive experience in healthcare sales, and that experience, I feel like, really reflects that deep commitment to driving business growth, fostering client relationships. So what initially drew you to the healthcare industry? How has your perspective evolved throughout your career?
Yeah, no, I appreciate the question as well, Laurel. I think as with most people, I was drawn into healthcare because I wanted to help people. And our healthcare system is so complex that individuals of all ages, of all socioeconomic status, they really have a hard time navigating through it. And they really dislike trying to navigate through it in those particular areas. Throughout my career, I've really seen how technology can improve on some of those pieces and reduce the overall cost of care, but I haven't seen how that cost of care savings is passed down to the member or to the patient overall. I do think recently, say in the last 3 to 5 years, CMS and the industry overall has really made a considered effort to try and pass some of those savings down to the member, and using technology to improve access to care, drive preventative care versus acute care, improve the overall member experience. But while we're focusing on those things, there's a long way to go, and that's really where I'd like to try and make an impact and continue to try and evolve in the industry.
Absolutely, and what an important aspect to keep in mind too, because I feel like my parents are in the baby boomer generation. I feel like that's where quite a few people's parents are, and it's quite a large population, that are in the healthcare, right? Yeah,
we get access to kind of seeing it and how it's difficult for our parents to navigate it. And even for those of us that work in it, we have a hard time navigating it. So if you're not in that, even in the industry, it's even more challenging. And so I think those are areas where Allison and I both really want to try and focus and just try and improving that overall process and experience.
Well, this is perfect. I'm looking forward to this conversation because of your unique, both of you, your unique experience that you have in this. And when we're looking at this, I think this is really interesting because I was reading that there are 12 million individuals in the United States that are dually eligible. And along with that, not only is that a huge population there, but a lot of them are also high need, high cost population. I think I was reading, and correct any of my numbers if I'm wrong here, but I was reading about 70% have been diagnosed with 3 or more chronic conditions, 41% with behavioral health disorders. So there's a lot of need there for that population. And I think it's really important that we have these discussions and where this can go for healthcare and solutions. So with that said, Allison, for you, given that experience in government program management, how do you perceive CMS's strategic framework evolving in response to emerging trends in the D-SNP market?
Thank you. So I think it's fair to say we're seeing this evolution in real time right now. So January, when CMS had published that initial strategic framework, and from there, and in the last 3 months, we've seen proposals for guidelines around D-SNP integration, aligned enrollment, and so all of these directly intertwine with that framework. Specifically, I'll call out the integrating the 3 M's, those being the Medicare, Medicaid, and KID, and Marketplace. So CMS has seen that these transitions between those programs, we see members with loss of eligibility, disruption in care, but impact that beneficiaries experience with health plans, with their providers. So I think this alone has the potential to impact millions of people, as well as hundreds of regional and national carriers that offer the D-SNP plan. So we've seen this slow but thoughtful evolution of the duals market over these last 10 years. So you see that beginning with the MMP plan, the demonstration financial alignment initiative. You've also seen guidance come out about D-SNP lookalike plans being terminated. So CMS is trying to get a full understanding and grasp of these health plans' impact on these, members with high needs. There's a great potential, I think, to help the members in these programs. And as those demos that I mentioned, the MMP, FIA phase out, I think we'll see a lot of movement, or we have seen, we'll continue to see a lot of movement to fully integrated dual plans, possibly an uptick in the managed Medicaid plans as well. But if anything, I see CMS's policies and strategic framework and evolving to fit the needs of these health plans. So I think it's a great foundation for what we're going to see as a lot of change in the next 5 years.
Great. Yeah. And on the sales side of things, to pivot that, Brian, as a sales executive in healthcare industry, how do you perceive CMS's strategic framework influencing the market trends and shaping the direction of health plan offerings, but particularly within that D-SNP market?
Yeah, as Allison was kind of even alluding to, CMS has definitely made a more focused effort to require or to encourage plans to help and support the most vulnerable populations, our seniors, our low-income individuals, children, marginalized populations. And we see them doing this through new requirements around health equity, continuing to stress the member experience through the healthcare process, and putting a bigger promotion onto financial and social assistance programs that can try and help improve access to care, help members maintain their coverage, which is oftentimes an issue. And really with a higher emphasis on, how do we pass along and reduce the overall cost of care for members to make healthcare more affordable and easier for them to access and to use.
All good things. All good things there. Yeah, that's how important that is. And I feel for me outside of healthcare tech, but keeping my eye on healthcare news, I feel like I myself have been seeing these sort of changes as well. So it's really exciting that there is the healthcare and the business aspect that is driving that. And you both mentioned some challenges, some opportunities that are involved in these markets. And so, Allison, to go back to you, would you be able to elaborate on some of those challenges, those opportunities that are involved in integrating Medicaid, Medicare, managed care within the D-SNP market, particularly with these changes in healthcare and technology?
Sure. And we've touched on, the current challenges of a member moving within these systems. So I think the guidelines in general that have come up from CMS and through the states have really sped up many of the industry integration timelines, which in and of itself is a challenge. Many of these health plans have technology roadmaps to go out 5-10 years. So when these new guidelines come out, it's a disruption. So this population we've mentioned, they frequently change health plans, elections, they lose Medicaid eligibility. But I think this D-SNP program really heightens the need for data accuracy, reporting, specifically with enrollment and UM. So I think what I've seen and what the conversations have been with health plans is just a thoughtful approach to their systems, to their technology. So we're looking at what will the future bring to kind of anticipate some of these needs within the market. So in adapting your systems, reporting technology, so to get ahead of some of the guidelines that will be coming out and of course, changing for the current guidelines out. So these have impacts all across the health plan. Give some examples. We're impacting some of the financial forecasting and STAR quality strategy reporting when we don't have accurate data, specifically in enrollment. So as far as what I see potential for health plan or puts them in a unique position to engage these members in a way that I don't think just a Medicare Advantage plan in general would. So these next come into a market where they're able to work with community support systems. They're able to offer quite rich benefit packages, putting supplemental benefits that fit the needs, the social determinant needs in the area. Maybe groceries are offered. We see many of them as over-the-counter medication allowances. So there's a great deal of innovation in the space that I think speaks to the population health management strategy that these plans are putting together, as well as, their future plans, that roadmap, that technology roadmap that would allow the member to have a great healthcare experience. And we see that this market has such growth. I mean, year over year, we see growth and the D-SNP membership. And I'll say it, I think it will continue the way we're seeing it. We've seen the numbers move in the last 5 years. But I want to also mention, because outside of current struggles, there's also mandates from CMS that are nationwide, not just D-SNP specific. So I think it's important to note that there's also increased accountability for interoperability. We see changes in risk models, supplemental benefit reporting. So these are just to name a few of the additional headwinds that these plans will see. but I think there is some great healthcare technology solutions out there that will lessen that burden as we move forward.
Yeah, that's great to hear. That's great because and unfortunately, none of these solutions are things that can be and anything can be implemented in a snap, right? There's always the process of it all, but it's really great to hear that you feel the promise of some really great tech solutions that can help this out.
Right.
And when looking at the sales and the solution design perspective, Brian, how do you approach those sort of challenges of integrating Medicaid, Medicare, and managed care services so that it provides a seamless member experience? And what innovations do you see that are driving that integration forward?
Yeah, it really is a challenge overall because you can't just snap your fingers and implement something quickly and easily to make a significant impact. And so health plans need to think and look strategically at their operations and not to keep beating the same drum. But a lot of it still comes back to making the process simple for the members to get the care that they need. Mm-hmm. That's really the focus that we have. And since the pandemic, we've seen a significant increase in solutions like virtual care, which can really improve access to care, can improve adherence to primary care needs and preventative care. But basic processes that health plans are doing, like member enrollment, claims processing, care management, all of these are internal processes that plans should be taking a member experience lens to, and not just taking an internal efficiency perspective. So how do they really improve the care for the member and improve the satisfaction that they have with the processes to keep them on their health plan rolls and to get them the type of care that they need when they need it.
Mm-hmm. Absolutely. And I feel like, I'm thinking of just even my own experience having used more of telehealth and more technologies since the pandemic and the ease of that. And I think there's some interesting solutions and some promise there.
Well, I will see more of those types of programs and pieces, become available and become more adopted by members and be more of the norm. And I think as we get to those types of things, it's going to create new ideas and new options and new ways and continue to evolve. So I think that's what's exciting about the opportunity that the healthcare industry has here right now.
Yeah, absolutely. And with the proposed policy for EAE, exclusively aligned enrollment, how do you, Allison, foresee this sort of thing impacting health plans' operations, the member experiences? What strategies should they adopt to navigate these changes effectively?
I think it's a great question, and a well-managed, fully integrated, and state-aligned plan has the potential to help your members experience tenfold. So allowing access to certain benefit packages that address all their needs they wouldn't normally find out in the market if it wasn't for, a D-SNP program or MMP program. We've seen quite a few available in the market, but I think the D-SNP is has the most potential to help a member. So we have seen oftentimes the Medicare and Medicaid program rules, they butt heads. So they're at odds. It's for provider network standards. We see it in marketing and member materials. So the communication with the member is a little disjointed, helping them understand what's covered under Medicare, what's covered under Medicaid. But the D-SNP plan, it's all packaged in one. So if they have appeals, grievances, that would go directly with the health plan as opposed to two different entities. So it can be daunting for everyone involved, including your providers. But I think exclusively aligned enrollment really has the potential to break through those barriers that we're seeing. And initially, I'll say the state buy-in for the dual specialty plan, really there was no incentive for the states to get involved. But over the last 10 or so years, CMS, they released guidance giving states, direct impact on this program. And it's allowing them to require D-SNP specific contract requirements in states. There's shared risk models that involve the state. So this transparency and collaboration, I think it's encouraged both the health plans and the Medicaid agencies come to the table and have some bigger conversations. And since this initiative started, I think it's truly blossomed into where we are today, which is explicitly in line enrollment discussion. We're seeing all 5 D-SNP plans requiring that EAE here in 2025. A couple other requirements tied to that, but I think it's truly a value proposition for member health plan, state level, to take a closer look at what they're offering and how they interact with the member. So I think if I was in a health plan, at the health plan in this situation, I would be taking a look at discussions that are happening at the state level with state agencies. I'll give an example of DHCS in California. What conversations are they having with their health plans, with CMS, taking a closer look at the benefits they're offering, the processes that the members are directly connected to, and looking at these, I would say, leaders in the D-SNP integration movement, the California, the New York, and looking at spaces where CMS is directly involved, because where you see high levels of innovation, I think we'll see CMS adopt guidelines and their framework in the coming years to look a lot like what they're doing in those spaces. So,
wow, it sounds like there's a lot of promise there, and when it's done well, there's been some really interesting development there that can be extrapolated out for other states, and I think it's really great to hear, and thank you for including some strategies there at the end and some action steps. I think it's really interesting, and to volley it back over in regards to business development, account management, and Brian, your expertise. How do you advise health plans to adapt to this proposed EAE policy and and being able to maintain competitiveness and also enhance the member satisfaction and experience?
Yeah, no, it's a great question. It's really at the crux of what I think CMS is trying to force or guide health plans to do. We've all seen over the last 5 to 10 years that integrated care produces better results for the member, better results for the plan and the practice in those particular areas. And I think CMS is really, with the aligned enrollment pieces, is really trying to push that further downstream within the health plans. Medicare and Medicaid lines of business have historically been very different and siloed areas. They've got separate processes, separate budgets, separate P&Ls. And I think leadership is being forced to strategically look at how aligned enrollment can optimize these processes into a single process. It can improve internal efficiencies as one, but it reduces cost. It can improve that member experience because they're not having to enroll with two different entities is what it feels like to the member in those pieces. It improves member satisfaction, which ultimately leads to better retention for the health plan, which leads to more revenue. Other areas that I think it's going to drive is that plans that, manage these dual populations, they really need to take a hard look at the supplemental benefits that they're offering to these members. And are they having the impact that they want? Or are they driving, better outcomes, better care, lower costs in those things that will ultimately, again, drive growth for the health plan and retention, which drives revenue, but it'll support the member in a more effective and efficient way.
What I'm hearing from both of you is wins all around. It's like a win-win situation for everybody, which is really important. And Allison, with your experience then in government programs, how do you anticipate state Medicaid programs reacting to the proposed policies and these initiatives that affect the D-SNP market? And what role do you envision for health plans in collaborating with state governments to address those changes?
So, for what I've seen personally, the conversations that I've had, I do think that the CMS public policies were encouraged by the states. They were hungry for transparency. They were feeling the pain of the disparity between these two programs. So I think it will look a lot like what I had mentioned before. The prioritization of collaboration between the two, I'll say three. So the health plan, the state, and CMS. So the example with DHCS, at the time, this was back in 2022. CMS and the HCS was working with health plans and the CCI counties. They were transitioning some of them from the MMP demonstration to a D-SNP model. Some of them transitioning D-SNP to the EAE. But these health plans, their stakeholders met with DHCS stakeholders. CMS was on the call sometimes to answer any questions, to gather feedback. With I think the most important piece of that, they were gathering feedback, but it was also being implemented, adjusted, and they were pivoting their project efforts based on that feedback. So it was really cool to see a whole project team, I would say, a committee, a work group coming together that were from different health plans, helping each other out and working in a way that really led to a success in the area. And I hope and I do believe we'll see something like this happen in other states as they move to fully integrated FIDE, D-SNP plan, EAE, HIDE. So I think what we'll see is, and what we have seen moving, not just California, but other states as well, is these type of stakeholder committees where they're bouncing ideas off of each other. They're giving feedback on something that the timeline doesn't work. This doesn't work for our system. Something that I don't know that a Medicaid agency Medicaid program would necessarily know. So this type of collaboration, I think, we'll see wonderful things if it's done in other states. So yeah.
Yeah, how exciting! That's got to be a very exciting thing to see. To see organizations working together in that way, because it could be challenging, right? And I am curious in how. I mean, I guess I should say, Brian, if you have any experience in this, like how other states in their Medicaid programs, how they're typically responding to policy changes in the D-SNP market. I mean, California was a great example there, Allison. But what strategies tend to be effective for those?
I think one of the areas that we continue to see is that health plans love to learn from other health plans' past wins or mistakes. And so many health plans and state agencies, they look closely at early adopters or the leaders. So states like California or in New York, and looking at different areas on how they've succeeded or where they've had issues to try and develop their own best practices. Similarly, I think a lot of regional health plans join health plan consortiums, things like the California Association of Health Plans or the Association of Community Health Plans, to again kind of collaborate with like-minded or like-sized health plans to try and learn from each other, and then collectively kind of develop what are the best practices and best processes to go through. And then obviously the political landscape has an impact on the strategies and the approach and the policies that states are going to have. Some of that's even political landscape at the state level and at the federal level. So the leaders at these health plans monitor all of those actions very, very closely to see what potentially could have an impact to the policies that they're going to have to implement and utilize.
Mm-hmm. Absolutely.
I will say, so Brian, I think it's a great point that these health plans are very close to what's happening, from a federal perspective. And I think I mentioned looking at what the states are doing and how they're collaborating. I think an easy way to do that and to keep track of, what other initiatives, innovations are happening in other states. A lot of these programs like CitiusTech, they have monthly committee meetings that they publish, meeting minutes, and there's policy guides out there, as well as, archives things, so you can see the evolution of this project over time, what's changed, what's being brought up at what time within the implementation of this D-SNP program, EAE. So I think that would be, I would think, a good takeaway for somebody who is looking at the D-SNP market and possibly having their health plan move to fully integrated or EAE, to look at those just one-off, the meeting minutes, what's discussed. Some of them even record listening in. So I think that's just an opportunity outside of, looking at federal guidelines to look at really the ground level, what's happening with the state.
Yeah, there's no substitute for experience or for somebody else's experience and learning from it.
So along those lines, bigger enhancements that we've seen nationwide as well as at the state level, and we've talked about it previously, but the community resources is huge. And using the technologies you have in-house, maybe new types of systems technologies to enhance that member experience. And we've talked, at the core of D-SNP is the population health management effort. So it's encouraging this holistic approach for the healthcare journey for these members. So I think it creates a trickle-down effect. So we're impacting the healthcare operations from a health plan perspective, your technology, clinical effort. I mean, it's touching each piece of the business in a different way. But I think the Spidey D-SNPs, they will absolutely be an increase in what I would consider a financial or operational, I won't say burden, but it definitely adds quite a bit to the health plan plate as far as managing their members. But if it's done purposefully, I think you are or the health plan is at a lower risk for moving into this market managing the population. So for the EAE plans, I think we'll see an increase in reporting, possibly implementations of new enrollment systems. You're going to be updating your policies, procedures. Your clinical team will have to take a different approach to how they're working with the members. And even with these standards raised, I do think these health plans and the states will begin to see strategic steps in that direction of fully integrated D-SNP. But it's an opportunity that I think a lot are excited for. I know I am. So,
well, and just to add on to that, Allison, I think we've seen a lot here in the last 3 to 4 years that health plans are focusing more on social aspects to drive as part of that care and not just being focused solely on clinical. I think there's statistics that say anywhere from 60 to 80% of D-SNP members' costs are driven by social factors. Where they live, their living arrangements, what food they can afford, those types of things, and supporting them with community resources and social workers can help prevent or delay or reduce the impact of clinical factors that will crop up later on in life. And so those community resources are becoming a bigger and more important area that members need the support with and that health plans are putting a focus on.
I would say you see health plans work closely with, churches and community centers and places that a member feels comfortable with, people they trust, which oftentimes isn't their health plan. So these community supports, we see it in the supplemental benefits or companion support, caregiver support. So I think meeting them where they are on their journey and what's comfortable for them, you'll see impacts on your population. And I think the health plan will see higher levels of trust. You mentioned retention. So it's a great point to make.
No, exactly. I agree.
Yeah, these are fantastic points. And as I'm hearing that, I'm thinking how that build better enrollment and trust in the system, better health equity as well too. And I think those are all things that just a lot of solutions that show a lot of promise for the future of healthcare. And Brian, to build off of what you were saying, as a VP of sales, how do you foresee proposed policies and these initiatives that impact health plan sales and the strategies and the revenue growth within the D-SNP market? What innovative approaches are you exploring on these opportunities as they emerge?
Yeah, I mean, health plans that can effectively manage a D-SNP program can be very profitable. They can make money, which is ultimately their goal, but then they can also help their membership and support them. However, poorly managed D-SNP plans can be catastrophic to a plan's success. D-SNP members are typically the most vulnerable and the potentially most costly populations that a plan will support. And the care management from a clinical perspective and a social perspective is at the center of a complex patient's healthcare experience. You really got to be focused on that. So health plans need to have a really robust model of care and a care management programs that thinks holistically and touches all of the areas that we just touched on or talked about for a member and meeting them where they want to be met and where they need to be met. Additionally, health plans and D-SNPs need to have really strong administrative processes to manage the plan. This includes a strong bid process to make sure that the right benefits are being offered that are going to resonate with members, that are going to be utilized and are going to help them with their quality of life. They need to have strong, aligned enrollment processes to make it easy for members to enroll into the plan and stay with the plan. And they need to have a really strong network overall. Members need to be able to get to the type of care from the people that they need it from and not have to travel extensively to do that. The EAE initiative will force plans to really take a proactive look at all of these different areas that, Allison alluded to a number of things from policies and procedures to enrollment processes to systems in all of those areas. But they also need to look at their member touch points to ensure that they're set up for success across all of those areas. And doing that in plans that haven't started to do that internal evaluation are already behind the 8 ball and are going to need support from the industry overall.
And if I could add to that, as far as the profitability, I think a well-managed plan, we see that impact, the STAR rating. When a member is highly engaged, if we're engaging them in the community or in other ways, but a highly engaged member is, I think, a well-managed member, which really transfers to your STAR rating. I also think you're walking on a bit of a tightrope here. We talk about supplemental benefits quite a bit. So I'll give the grocery allowance as an example. So many D-SNPs are offering hundreds of dollars in allowance for APC and groceries, which is incredible for members, especially in this time we're living. But there's a high utilization there. So we're seeing members use the benefit a lot. That's great. So the more they're using it, the better off their lives are at leading healthier lives. That the more involved they are with their health plan. But when you have something that's highly utilized, it has to be well reported. Now with the new guidelines that come out from CMS, it has to be very clear in your marketing strategy because members, oftentimes there's complaints about how things are marketed. And then it has to be well implemented because if members are using it, they're not having a good experience, they're complaining, you're starting to see, complaints to Medicare, complaints about salespeople not being clear about the marketing around the plan. So I think there's a tightrope that you walk when you're looking at the profitability from well-managed from a supplemental benefit perspective.
Yeah, making sure that the benefits resonate with the members, they're easy to use and easy to access, and they're easy for the plan to track utilization and be able to report on. All those things are critical.
And speaking of the member, and to close things out here, what advice would each of you offer to people looking to make better healthcare choices and leveraging technology for their improved well-being? Allison, may I start with you?
Sure. So I've seen it firsthand how innovation and technology positively impacted myself. I've seen it impact the member's health journey. I think data and applications on our phone that gives insight into your health that you wouldn't see otherwise. So I think deciding what's important to you, your doctor, and then doing a lot of research, and then working with your health plan. Health plans offer a lot of extra applications and certain things that you can use to better your health that are free to you because you're a part of that health plan. So I think finding a company and a provider that has a high level of integrity. And I say if you're on your phone anyway, let people use it, better your health.
Absolutely.
Agreed.
Yeah. Brian, your thoughts?
Yeah, really for the members, I would advise members to leverage the benefits and the assistant programs that are available to them. I think up to about 50% of Medicare members qualify for some sort of financial assistance and are not taking advantage of it. This could be they qualify for dual coverage, so they can be qualify for Medicaid. They might qualify for low-income subsidies and prescription assistance. They could qualify for food assistance or utility assistance. and they're not utilizing these because it's complex in the system to be able to access it. And I think as a healthcare industry, we need to make it easier for them to get that. But if members can start taking advantage of those programs, it'll improve their overall quality of life. It'll put money back in their pocket, and it'll improve their care overall. So I think to me, that's the biggest advice that I would give members.
That's excellent. Thank you. Yeah. Well, gosh, Brian and Allison, thank you so much for your expertise and what you've brought to this conversation today. It's been really fascinating to hear more and hear about the future and the promise that's there for these D-SNP programs and just where this is all headed is very exciting. And as an end user, to hear the future of this all is great. So thank you both very, very much for your time and your expertise and for joining me today.
No, thank you, Laurel. It was fun. This is the first one of these that I've done, but really, really, really appreciate it.
Well, good. You did great. You did great. Thank you so much, both of you, and have a wonderful day.
The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.